Ladies and gentlemen, please welcome Julie Hyman from Yahoo Finance and Dr. Rajiv J. Shah of the Rockefeller Foundation.
Good afternoon, everyone, and welcome. Thanks for being here. Raj, I wanted to dive right into it and start with some really interesting survey work that your team has done, because I think the priorities that are your priorities are probably shared by many of the people in the room. It's become increasingly clear that it's not necessarily the same priorities that are shared by global leaders, for example. But what this survey work shows is that individual people share many of these priorities. So one of the questions in the survey work you asked, my country should cooperate on global challenges even if it compromises national interest. And most people agreed with that statement. So talk to me a little bit about this data and what it tells you.
Well, Julie, first, it's great to be with you. I think we're all gathered here on the margins of the UN General Assembly during a week that is fundamentally about global cooperation. And obviously, we are living through a crisis of global cooperation. Just the shutting down of U.S. aid and the 83% reduction in American foreign aid assistance has been modeled out to, will yield about 14 million lives lost by the Lancet Commission that studied this, including 4.5 million lives of kids under 5. That's a human tragedy in terms of lives lost. It is also a geopolitical tragedy because it will yield instability in many parts of the world. And of course, other nations have followed suit, and so the real consequences are even worse. So we looked at this crisis and we said, well, is it really true that the populations of countries across the planet don't want to do this work anymore? And we did a poll. We reached about 36,000 people in 34 countries. And the poll shows what you started to illustrate, that in fact, 75% of respondents across all 34 countries said they would support global cooperation and more global cooperation. A majority would support it even if it was costly in some form. When you actually look at health, water, and food security for those who are vulnerable, the percentage of people that would support foreign aid and assistance was between 91 and 93%, depending on which of those issues you're speaking about. So clearly, the people in countries across the board, when they believe the work delivers results, are willing to not just support it, but see it as a part of our common humanity and understand instinctively that we are stronger, we are safer, we are more secure when we help those that are least amongst us.
One of the other things that stood out to me from the results, do you agree with this statement? Do you agree that the political system is broken? And again, you surveyed all of those people in different countries, so it's not specific to one country. Globally, 64% said yes, the political system is broken. In the US, 67%, this is not shocking, said the political system is broken. So if that's the case, and yet people want to help their neighbors with these things we're talking about, who does it? Who steps in? You know, that's why we're all here, obviously, but concretely, how does it happen?
Yeah, well, I'm a fundamental believer that it requires public action, that no amount of philanthropic or civil society innovation and engagement can substitute for nations departing from an 80-plus year consensus that grew out of the Atlantic Charter that said we are stronger and safer if we help those who are suffering the most. Whether those are post-World War II people going hungry in Western Europe, or whether those are young kids in Sudan or Gaza or somewhere else in the world that are currently under siege. And so I think public action is always critical. And frankly, in my experience leading USAID under President Obama's administration, I learned that America remains, and I think will always be the world's humanitarian shining light. When we shine a light on an issue, whether it's the Ebola crisis in West Africa or the hunger crisis in the Horn of Africa, et cetera, others follow. When we don't, others can still come together and do things, but it's different. Now, what do people want to see in the polling data? People want to see results.
Right.
And the reality is the way you get results is not just public bureaucracy doing its work. In fact, I think in the question that asked, what do you think about the UN or what do you think about the World Bank? If you ask about a bureaucratic institution, only 40 or 42% of people were supportive of those institutions. But if you talk about the work that is done and the results that are delivered, folks are wildly supportive. So I'll give you one example. This past January, we brought together 27 African heads of state. They, together with their developmental partners like the World Bank and the Rockefeller Foundation, committed more than $50 billion to very specific plans and programs to provide electricity to 300 million people who otherwise don't have productive power. No productive power means no jobs, it means no learning at night, bad health care, all of the above. So it's mission critical. Over the course of the calendar year, we've studied the impact of that initiative, and we've gone from providing about 400,000 new electrical connections a month to now providing 1 million new connections a month. And we can study the impact of that 150% acceleration in the rate of electrification, and I can show you community after community where girls are going to school, where farmers are using equipment that's powered by electricity and are much more productive in their post-harvest processing, where women in particular are starting or growing their small businesses and creating jobs for their neighbors. Those are the kinds of results people in this poll have said in 34 countries, you show us the results, we will have your back. And my only advice to our wonderful leaders gathered here at the UN General Assembly is listen to your people and do your job. Your job is to help create an aspirational form of leadership where we're tackling the world's toughest problems in a smart, results-oriented way. If you do that across every one of these nations, your populations will support you.
Are you finding them receptive to that message?
Well, we get to work with the select leaders who are extremely committed to that mission. Tomorrow, President Mahama of Ghana and 8 other African heads of state are coming to the Rockefeller Foundation to develop a plan and implement a plan to take over more of the global health activity that over the past 2 decades has been a shining success story at saving children's lives, at putting nearly 20 million people on HIV/AIDS treatment and saving their lives. And these are nations saying, we're going to take the responsibility to do this ourselves. We're going to integrate procurement supply chains. We're going to build digitized data systems that are efficient and effective. We're going to bring human resources from these NGOs into our public systems. And we're going to introduce new TB diagnostics that are low cost and enable more effective outcomes, or long duration antiretroviral treatment so that we can lower the cost of saving a life from HIV/AIDS. Those are the kinds of leaders I get to work with all the time, and so I remain extremely hopeful that the majority of the world's leaders very much remain committed to the unbelievably simple post-World War II idea that if you help address vulnerability, suffering everywhere on Earth, and you provide dignity to people who otherwise are deprived of that dignity because of not their fault, but their circumstance, that you're making the world a safer place.
You talked about those heads of state coming together, that there is still this willingness. What about the funding? What about how you get it done?
Well, the funding is the gap, and health is a good example, and I mentioned the African leaders that are joining us in this initiative. We're supporting their leadership and their initiative. But we've seen a 30% reduction in global health funding year on year. A lot of those 14 million deaths that I talked about when the Lancet Commission did its analysis are because of the just absolute shutting down of global health programs that have been, on a bipartisan basis, the shining light of American diplomatic engagement over the past 2.5 decades. So there's a funding gap, and it's a significant one. Now, how are we going to solve it? I think we're going to redesign the system. The Rockefeller Foundation has created this $50 million portfolio we call Building Our Shared Future, to bring these leaders together and literally redesign systems to lower the cost and improve the value for money to taxpayers. And then we're going to do the hard work of talking to people across this planet through whatever channel we can reach them and try to make these polling data results much more reflective of our actual politics. And when I ran USAID, I could go to a black church in Detroit, a city where I'm from, in a community that didn't have a lot of resources, or I could go to Fort Benton, Montana, and sit with farmers who were working hard. Some were succeeding, others were not. Very different demographics, very different politics, very different red and blue. But if I talked about how America was on the front end of helping orphans in Rwanda be protected, that church in Detroit took up a collection to support the orphanage in Rwanda. If I sat with our farmers in Montana and explained that we have designed an effort to help 40 million farmers in 11 countries improve their productivity and prevent hunger in the first place, they're the first people in line to support our efforts. So I think we got to do more of that work too, of talking to communities and helping people appreciate that this isn't just a New York elite institutional expert project. This is common humanitarian kindness applied in a strategic way to improve our planet.
So when you talk about new initiatives like building the shared future, but you also talk about going back to things that have worked before, but how do you have to get creative in this new environment? What is going to require rebuilding, re-architecting, rethinking to address the current landscape?
Well, I think it's three things. The first is we just need the right leaders in the room to help kick this off. So this morning I was with heads of state and leaders of the major developmental institutions at the Rockefeller Foundation as we launched this effort. And I can tell you they are absolutely committed to saying, no one is trying to advocate for business as usual from 5 years ago. Everybody wants to build a different future. So step one is get in the room. Step two is we have to have the courage to say what doesn't work. Malawi has to fill out 116 different applications and deal with a broad range of donors just to run its public health program. That's not sensible. It's just not reasonable to have, and you talk to minister after minister and they'll just say this system is broken and it needs to be rationalized, needs to be fixed. So part of our dialogue is saying what's not working, what's too expensive, what can be made more efficient, how can we improve the situation. And the third part is actually just core innovation. We just are following a panel on artificial intelligence. Today, we're helping to support the use of AI to help turn community health workers into more skilled nursing support partners because what they have in their hand is so much more powerful in terms of knowledge and support that they can offer a family in need. We can use AI to improve diagnostics, so you no longer need radiology services and radiologists in certain parts of northern India. You can just have AI support the function of diagnostics even at a relatively advanced level. We work with partners in agriculture that are working to dramatically improve our knowledge of soil conditions, agricultural production, all using AI, or biotechnology being applied to improve productivity, not by using GMO technology, but by using CRISPR and newer forms of basically natural selection. So, the technology and innovation frontier, ironically, has never been more empowering. And if anything, building our shared future is about redesigning this system to be more effective, efficient, results-oriented by harnessing that innovation.
And I'm curious, too, how you look outside the normal parameters of partners. How do you get more creative about who can help with this, who maybe hasn't been tapped into before, even if they're part of those survey responses who want to help, but they haven't necessarily had that avenue?
Okay, so we are trying to reach every possible partner. We will talk to YouTubers that have their own following. We will talk to smart, new, novel AI startups that are just trying to build and test the use of certain products. We work with large established companies as well. But fundamentally, and I think this is this theme or spirit of Concordia, but I do think public-private together is far, far, far more likely to be successful, innovative, and efficient than public alone. And so the hard part is just keeping up with how quickly private changes and dealing with all partners in a totally open manner.
All right, Raj, I guess we should leave it there. Thank you so much. Really appreciate it. Thank you for your attention.
Thank you, Julie.